Hello, everyone. Welcome to LAM-CAA Assessment. Still on diagnostics. Week 10, we are going to review pulse diagnosis. Let's start with the first one. Dr. Mary Angeli Templo, good evening. Good afternoon.
Good evening, Doc. Good afternoon po.
Yeah, how do you define pulse diagnosis?
Pulse diagnosis provides detailed information on the state of the internal organs, the complex of chi and blood.
Okay, so actually we are able to assess the physiological and pathological states of the patient, no? Both physiological and pathological, based on the pulse quality. What is the pulse relationship
Okay.
with chi and blood?
The pulse arises mainly from the flow of chi and blood in the vessels.
Okay, so what we are actually assessing is the flow of chi and blood in the vessels, no?
Yes po.
What is the role of the chi?
The chi in pulse generation is associated with yang. It governs blood and it plays major role in pulse quality.
Yes, it governs movement, no? That is why
Movement.
we should always compare the left pulses and the right pulses. Usually the right pulses will tell you about the chi, so that's yang, and then the
Mhm.
left pulses would be the yin and blood, no? So there should be no disparity between the two. Later we're going to explain this. What about the role of blood? Hmm.
The blood is associated with yin, and this provides substance that fills the vessels. It depends on chi for its movement.
Okay, so if there is no chi, there will also be no movement. If you remember, blood is the mother of chi, and chi is the commander of blood. And blood
Blood.
is
Yes.
yin. So yin is anything substantial. So this provides a substance that fills the vessels. So if you
Mhm.
have a pulse that's very thin, then most likely, or thread-like, most likely blood is too little, no, or blood is deficient. That's the
Blood
take.
is sufficient.
Now, what do you mean by chi deficiency or chi is insufficient and fails to move blood? So what will happen to the pulse?
The pulse at this time is forceless and choppy.
Okay, very good. So if you have um, chi deficiency or chi stagnation, there will be, chi deficiency rather, I'm sorry. Chi stagnation is excess, no? So when you have chi
Mhm.
deficiency, there will be forceless pulse or it can be choppy, di ba? Just like the signal that we have sometimes because blood flow
Yes.
will not be smooth if there is
Yeah,
insufficient.
blood flow.
Yes. Okay. What will happen if the blood is deficient and it fails to move or fill the vessels? What will be the pulse quality?
If the blood is deficient and fails to move, it's thin and hollow
Very
pulse.
good. Yes. Number 7. So the substance of the pulse is considered to be what? The substance.
The blood.
Very good.
The
So the
blood po
power of the pulse,
is the chi.
very good. So it's just chi and blood. No? Okay. So what organ
Yeah,
governs the heart, governs the blood and the vessels?
it's the heart
Very good. Okay, what organ gathers the 100 vessels?
and governs the chi. It's the lung.
Very good. If we say governs the chi, napaka-obvious. So, this
Yeah.
tandem, this pair transforms and transports and controls blood.
It's the stomach and the spleen.
Very good, Doctor. Okay. What organ stores blood, ensures that the chi flow is smooth?
The liver.
So if the liver is affected, if it's stagnated, then flow of chi
There
will
will
not,
be,
there will be chi stagnation. No? And
yes.
okay, what organ stores the essence which transforms into chi and blood?
So it's the kidney.
Good. Okay. The pulse quality, I think you mentioned this earlier, no? The pulse quality can help one to do what?
Assess the different physiological and pathological states of the patient. It also
Okay.
reflects the flow of qi and blood in vessels.
Okay. It also differentiates the thermal nature of disease. No, it assesses the pathogenesis of
Okay.
a disease, and um, and this will give us the prognosis for the disease. Obviously, those with
Okay.
strong pulses will have better prognosis. Okay. What do we get when we take the carotid artery pulse at stomach 9? Stomach 9 is
The stomach qi.
very good. If you know how to do this in facelift, no, you try to needle stomach 9, but you have to be very
Yes.
careful. You will notice that um, the stomach coating will improve. And at the same time, there will be lifting
Mm,
of the face. So you do it on the ear. You'll be amazed, Doctora. Promise. Stomach 9.
or irregular. Yes.
Okay. What about the radial artery pulse? Why do we need to have like three pulses on, yeah, three superficial and three deep, both left and right,
The radial artery pulse. This corresponds to the 12 channels.
12 channels, 12 channels. Okay, what are we determining when we pulse, palpate the dorsal artery of the foot pulse at stomach 42?
Um, Kidney chi. Stomach chi pala.
Stomach chi. So stomach chi is stomach 42 and stomach 9. Pulse at radial artery.
Uh,
What does it reflect?
it reflects on the functional status of Zhang 4 organs.
Very good. Radial artery is the artery through which, can you tell us more about it? The importance of the radial artery.
The Yeah, the Han-Taiyan channel of the lung passes, and this is the area where the qi and the blood accumulates.
Mhm.
This is also where the circulation of qi and blood in all Zangpo organs starts and ends at the lung.
Actually, in Western medicine, this is the one that we're testing, diba? So it makes sense because this is where
Mhm.
the area where the chi and blood accumulates, and where the circulation of chi and blood starts and ends at the lung. Okay, what is
Mhm.
considered to be the sea of food and water and the source of the sixth food?
For the sea of food and water, it's the spleen and stomach. But for the source of the sixth food, I don't have.
It's the
Okay.
stomach.
Stomach
It's
pa rin.
yes,
Ah,
stomach pa
okay.
rin. Okay. What do you mean? Um, what do you mean by superficial death? Example, you feel the pulse and it's very superficial. Or how do you examine, how do you palpate this?
Super superficial depth. This is when the skin is just slightly touched, and then you will feel the pulse and felt at the skin, at that
In
skin
level.
level.
Very good. So what about the middle depth?
When moderate amount of pressure is being applied, pulse is felt on on that muscle.
Yeah, the muscle level. The deep depth.
Um, when a heavy pressure is applied, the pulse is felt at the tendon and bone.
Yeah, tendon and bone. So you have to apply. So it all depends on where you feel the pulse. So normally it should be at the middle level. No?
Middle.
Time, when is the best time for taking the pulse?
I have here is early morning because this is an optimum time to take pulse when the patient and the practitioner is calm and the yang has not risen.
Okay, so the pulse diagnosis in the afternoons are not is not quite reliable. But again, you can always compromise. Okay, describe the posture for pulse taking.
Um, Sitting or supine with the area about heart level, like taking a blood pressure. The wrist is extended and the palm facing upward.
Okay. The palm should face upward. And the fingers, what about the fingers?
The fingers.
They should be slightly bent. Hmm?
Mm-hmm.
So the patient can be sitting straight or lying on his back, the arms naturally extended at the same elevation as the heart. The wrist
Okay.
extended, the palm facing upward, fingers slightly bent with a soft cushion placed beneath the wrist. Okay, what is the duration of pulse taking?
Not less than 50, what's this, or 2 to 3 minutes.
2 to 3 minutes. So if someone takes the pulse in just 30 seconds, that's questionable. Okay. So
Yeah.
what is the rate of the normal pulse?
It's about 4 to 5 beats per breath for the practitioner's breath, and the normal pulse should be 60 to 90 beats per minute.
Very good. So this time we don't, um, sometimes the practitioner's breath is not also reliable. So we have
Ah, okay.
batches now. So you just take it for 15 seconds, multiply it by 4. So 60 to 90.
Okay.
What do you mean by
60
stomach
to
chi?
90. Um, it's a physiological functions of the stomach and spleen in the middle burner, including function of the digestive system.
Okay, this is actually the basis of the pulse, no? It is the motive force for generation of nutritive substances in the body. That's why we always needle the stomach and
Uh-huh.
spleen points. Okay, formation of
Okay.
the pulse by the stomach chi. How is the formation of,
Stomach chi forms the pulse by creating the good chi, the gu chi.
yes.
The stomach and spleen are the root of acquired chi in the body. Their function is the transportation
So the stomach chi forms the
and
gu chi.
controls.
So if you remember the basics, no? So it all boils down to
Yes,
basics.
po.
Yeah. Qualities of the pulse when stomach chi is full or yeah, full.
Um, Not too wide or too thin, not too long or too short, neither superficial or deep,
Yeah. So
slippery.
the pulse beats should be calm, gentle, steady, regular rhythm with moderate strength, not too wide or too thin, not too long or too short, neither superficial or deep, slippery or choppy. Most patients that you see in the Philippines are slippery, yung pulse. So
Mhm.
how do you define spirit?
Spirit is the vitality and phenomenon of life, a reflection of normal function of the Zangfo organs and sufficient qi and blood.
Okay, very good. Pulse, what do you mean when the pulse is full spirit?
It means pulse with strength that reflects the stomach, the smooth flow of qi and blood. Pulse beats with moderate strength and even rhythm in a soft vessel.
Very good. Clinical significance of the spirit.
It's the status of essence, qi, and blood,
Mhm.
and this can be detected from the spirit of the pulse.
Okay. So with the spirit of the pulse will actually reflect the status of the essence, chi, and blood, no? And the spirit of the pulse is related to prognosis of disease. How do you define root? Not
Root means source of
life. Yes.
source of
Okay.
life.
How is the formation of the pulse root?
Kidney chi forms the root of the pulse, and because kidney is the congenital root of human.
Very good. A pulse that has root, how do you describe it?
Pulse can be felt at the deepest depth at all three positions, the distal, middle, and proximal.
Okay. And the pulse that can be felt at the proximal position, any depth,
Proximal
is
position.
considered to be rooted. Proximal, the one closest to you. No? TCM pulse diagnosis. What is the what are we trying to look for here?
Um, the width, depth, strength, length, rate, rhythm, tension, shape of the pulse are the basic components of a normal pulse.
Very good. Okay. What is the width, the vessel's diameter?
This reflects vessel's diameter influenced by chi and blood status. The diameter of the blood vessel is dependent on the chi and blood.
Very good. What about depth?
The This is the location where the pulsation is the strongest. The normal pulse depth should be felt in the middle depth.
So not the deep depth. It should also not be felt on the
Yes,
superficial depth, should be the middle depth. It
middle.
shows that there is sufficient stomach chi and that the chi and blood of the body can flow freely from interior to the exterior as well as to the Zanfu organs. What do you mean by strength of the pulse?
This the beating force beneath the finger. Strength of the pulse reflects the condition of chi and blood.
Very good. Chi and blood. Okay. What about the length of the pulse?
Chi plays the major role in the length of the pulse. This measure of its length in relation to the three positions, distal, middle, and proximal.
Very good. Major. It's the chi that plays a big role here. What about the rate?
This refers to the number of beats per minute. Mhm.
Normal pulse rate, 60 to 90,
4.4,
or to
yeah,
5
60 to
beats
90 beats per minute, or 45
respiratory cycle.
beats
Yeah.
per respiratory cycle.
And the rate is determined by the state of the young because it governs the movement of blood via the lung and heart. What is the rhythm?
Um, Okay. Rhythm is a manifestation of heart chi's command over blood movement, with other organs playing a lesser role. The
Okay.
pattern of pulse beats
The pattern of the
consistent
pulse
and reflect
beats.
harmony.
Okay.
Yes.
So if the rhythm is irregular, then the heart chi is deficient. What do you mean by tension?
Mm. Tension of blood vessels indicates the state of chi and blood flow.
Okay. So the normal pulse should be neither too taut or too slack. It is the manifestation of the chi and blood and the condition of the blood vessels. What about the shape of the pulse?
This is the waveform or contour of the pulse, rising and falling of the vessels as the blood flows through it. In normal pulse, rising and falling of the pulse are the same.
Okay. And the condition of the blood vessels, the chi blood determine the pulse shape. So, how does the pulse change according to season?
Mm. Seasonal changes influences pulse quality, causing variations within the normal range. Pulse
Okay.
quality may, yeah,
What about during springtime? How do you describe the pulse?
it's wiry.
Okay. Summer is flooding, autumn is floating,
Flooding,
it's deep. Okay.
winter is deep.
Okay. What about geography and environment? Can you describe the pulses? Let's start with the moist and warm regions, just like Philippines.
Yeah, for moist and warm regions, this may lead to a saggy and slightly rapid pulse.
Okay.
For dry and cold regions, this may result in a deep and forceful pulse.
So you have to consider the geography and in the environment. Huh? What about for gender? As in terms of gender of the female compared to the male pulse.
Yeah, for female, they have weaker, thinner, slightly more rapid than a male.
Okay, weaker, thinner, slightly more rapid. Okay, in terms of age.
Tea and blood in an elderly can be weak and deficient, which can make the pulse feel empty and forceless.
So in other
For the
words,
young,
yeah,
yeah,
yes. For elderly, expect the pulse to be weak and deficient. What about for the young and
yes,
strong?
the chi and blood will be full and exuberant, and the pulse will not arrive with
They will
will
arrive
arrive with full,
with full force.
full force.
Okay. What do you mean by deviated angle pulse?
The radial artery is not found where it is expected to.
Okay. The diet. How can the diet affect the pulse?
Spicy foods can make the pulse become slightly more rapid.
Yeah. And alcohol will make it rapid, more rapid and forceful. Sige, try drinking alcohol a lot. Okay,
Yes.
what about the change in width, hyperactivity of the young? So we can have
With
we have excess and deficient, diba? Mm. So let's start with excess.
wide width may signify hyperactivity of yang, and thin width indicates yin and blood insufficiency.
Okay. If it is due to excessive heat in the body, of course, the young is very hyperactive. It will raise and move the chi and blood to expand the blood vessels. Now, if the yang is hyperactive due to yin, of course, when you have yin deficiency, the yin cannot control the yang. So there will be outward floating of the
Mhm.
yang, sorry, due to the depleted yin failing to control the yang. So describe the normal pulse.
The normal pulse should have a good shin, which is meaning it has distinct and has force. It has good stomach chi, meaning flexible, harmonious, slippery, and uninhibited, not deep. It should have good root. The chi position can be felt all the way to bone, and overall, all positions, neither floating or deep, harmonious, moderate, 64 to 90 beats per minute, and have force.
Yeah. So I hope you have started to take the pulse of your patients, no? So a good stomach chi should be flexible, harmonious, slippery, uninhibited, not deep. So good root, sure position can be felt all the way to the bone. So if you notice, most patients, especially if they're elderly, you can hardly feel you can only feel the sure at the root, at the deepest level, no? Overall, all positions, neither
Mhm.
floating or deep, harmonious, moderate, have force. Okay. So, how do you define floating or superficial pulse? Or how do you describe it?
This is exteriorly located, felt with high pressure, but disappears with heavy pressure when
Okay.
the pressure is released.
So when the pressure is released, it always reappear at the surface again. What about deep
Yes.
pulse?
This is felt only with deep pressure.
Great. Slow pulse,
Uh, it has 60
less than
beats per minute or less than 60 beats per minute or less than 4 beats per breath
of the practitioner. What about rapid?
of the practitioner. Rapid, it's more than 90 beats per minute.
Vacuous or deficiency? A vacuous pulse or deficient pulse.
Uh, this is a generalized term for forceless pulses, slow, large, floating, empty, vacuous, soft, forceless pulse image.
Okay. So if it's deficient, the pulse is forceless, no? Soft, empty, and large and floating and slow. Scallion stalk pulse or hollow pulse. Please describe it.
This is a floating, soft, large body but empty center like scallion.
Okay. You've seen a scallion stalk, no?
Mhm.
Empty at the center. The pulse felt superficially as soft, but with heavier pressure, disappears rapidly and completely. Why repulse? This is also very common. Please describe it.
Um, it's fine, long, has strength, feels like a lute wire.
Very good. Surging or flooding pulse.
It's a floating, large, comes on exuberantly, departs debilitated, like an ocean wave coming onto shore.
Very good. Faint pulse.
Indistinct, insufficient, extremely fine or thin, soft, barely palpable, and even when found may lose it again. It's extremely 3D and soft.
Yes, very good. Hello, Sir Dino. Okay.
Hello, Doc.
Parang nagkamali kaya. Sige, okay
Ah,
lang. You're welcome. It's an honor to have you. Hindi Doktora
Kapalit
Tancho.
pala ng damit.
So far, wala pang, ay okay. Nagpapalit ka ng damit sa harap ng ano ha? Okay, sige. Long pulse.
This is long, can be felt further up forearm than usual.
Okay. Short pulse.
Does not reach its location or range, does not reach tune section.
Okay. Slippery pulse.
It comes smoothly flowing and uninhibited, feels smooth like pearls rolling in a dish.
Okay. Choppy. Just like the signal in the internet.
It's slow, relaxed, fine. May stop and lose a bit but then recovers. May not hit with the same force each beat, a sense of slowing down and speeding up.
Good. Tight pulse.
This is tight, has strength, feels like a taut rope, not fine and greater strength and size than wiry.
Oh, good. Moderate. You can usually feel this tight pulse if your patient is feeling nervous, feeling cold.
Mhm,
Okay.
mhm.
Relaxed. Okay. Or moderate pulse.
This is it's relaxed, loose, slack, right on verge of slow.
Okay. Hidden or concealed.
Um, Difficult to feel under the sinews, not obvious, requires heavy pressure to bone to feel, even deeper than deep balls. It's extremely deep.
Okay. Very good. Fine or thready.
The pulse is soft, feels like a silken thread, weak without strength but persistent, not scattered by pressure.
Okay. Okay. What about bound? Bound irregularly irregular.
It's slow, relaxed, stops at irregular intervals.
Okay. Actually, you may not be able to really observe all of this. No? Weak pulse.
Yun, weak. It's deep, fine, soft like thread.
Okay. Soft or soggy pulse.
It's floating, fine, soft, relatively forceless, flexible, felt with light pressure but not with heavy pressure.
Right. Okay. Regularly interrupted, regularly irregular.
Comparatively relaxed and weak, stops at irregular intermittent intervals. These intervals may strikingly long, keep beats more than hasty or knotted pulse.
Drum skin pulse.
This is floating, wiry, large with empty center, with heavier pressure, disappears. Feels like head of a drum.
Yeah, this is very common amongst elderly. No? Drum skin. Alam niyo naman drum skin, no? Confined
Yes.
pulse.
In deep position, it's large. It is in deep position, large, wiry, forceful, long, unlike hidden.
Okay.
Pressed superficially or moderately, does not respond.
Okay. So Welcome, Sir Darwin, the future CAA from Pampanga. O, di ba? Please meet Sir Dino Pinheiro, malapit na pong mag-CA. Saka itong si Doktora Templo. Thank you po for joining. Yeah. Scattered pulse, how do you define it po?
It's floating, large, without truth, even with light pressure, easily changeable, becoming scattered and chaotic, disappears with heavier pressure.
Do you know how many pulses are there? Para tuning the practicum, we will
Ang
only,
dami, Dok, nakakalito.
grabe no, ang dami. Pero sige lang, for academic purposes, we need to know lang these things. And I think I gave you like 3 books on pulse diagnosis. You ask Sir Dino, master niya po itong pulse. Taga ano, Legazpi. Okay,
Hirap yan, Doc.
so slippery, rapid, forceful, ang steering, no? Parang jumping bean. What about skipping or rapid, irregularly interrupted?
This is rapid skips at irregular intervals.
Usually ito may heart issue na po. Large pulse, how do you define it?
Large, fills up fingertips, forceful, wide, broad, broad.
Okay. Racing pulse.
This is very rapid, less than 120 beats per minute or 7 to 8 breaths per beat.
Okay. Floating, okay. Ano yung category ng floating pulse? So that means all of these pulses are floating. First,
One is floating, hollow, drum skin, soft, saggy, vacuous, surging, flooding, and scattered.
okay, so floating, that means you can feel this at the superficial level, no? All 7 of them.
Superficial.
So can you imagine? Memorizing mo yan.
Ang dami.
Deep pulse naman, konti lang. Okay, there are 4. What are
So
they?
first, deep, hidden, confined, and weak.
Slow pulse category.
First is slow, second is bound or irregular. Third is regular, irregular, or regularly intermittent. And fourth is choppy.
Rapid pulse category. There are 4.
First is rapid, two is skipping, rapid, irregular. Third is racing, and fourth is steering.
Okay. So sana ano, pinapractice ito. Forceful. What are 4? Okay, there are 7.
Forceful pulses are replete, wiry, steering, slippery, confined, long, and large pulses.
Very good. Forceless. Walang kalatoy-latoy.
Forceless pulses
There are
are minute, fine, weak, vacuous, hollow, scattered, saggy, and irregular, regularly interrupted pulses.
great. What are the 3 characteristics of a normal pulse?
First, it's with stomach chi, peaceful and moderate feeling with even rhythm. Second, with shen, that means it has strength. Third, with root, deep portion of her position is even and moderate and doesn't disappear with heavy pressure.
Okay. How do you describe a normal pulse? Ulit.
It reflects good heart chi and blood. It should be calm, smooth, soft, but not too soft, and not slow, rapid, rough, or hard. It should be regular. Its quality should not change very often or easily. Deep level and rare position should be felt clearly, indicating that the kidneys are healthy.
Okay. It should be palpated at the moderate level. You will notice, Doctora, no? Um, if the patient is not young anymore, the liver, the what's this the sure, yung kidney pulses and the middle pulse, the quan,
Mm-hmm.
the liver and the kidney, they don't have, you cannot palpate them at a moderate level. So that means it's a sign of aging.
You have to go, and you
But
have to go deeper.
yes, and the interesting thing here is you can always make it appear at the moderate level. So we'll show you how. It's a practicum. No?
Mm-hmm.
Normal pulse indication. What does the normal pulse indicate?
I don't have answer here, so
Person is normal and he
normal
have a
person.
light disease, normal person or LT. Okay, what are normal pulse
A light
variations?
disease. Seasons, geographical and environmental factors, gender, age, mental state, physical work or exercise, diet, pregnancy, and menstruation.
Okay. Athletes will have a slower pulse. Okay. Children, faster. Obesity, deeper kasi malaman.
Mm,
Thin, very superficial. Women, softer and faster. So, you would know pag trans
okay.
or ano. Pregnant woman,
Okay.
slippery, left stronger.
Left stronger.
Okay, ito ha. I don't know, I haven't practiced this, but if you have a pregnant patient, sige, try nyo doktora kaya. You let me know ha, kung ilan yung tuma.
Mhm.
If the left, of course, if the left pulse of the woman, pregnant woman is stronger, it's a boy. If the right pulse is stronger, it's a girl.
Mm,
Yes.
ayun pala yun.
Left is, alam ni ano yan? Si Sir Dino, ewan ko. Basta left, sige, buntisin mo.
Left. It's a boy.
Yes, left it's a boy, right it's
Stronger.
okay. Tingnan natin
It's a
kung ilan.
girl. I'll try
Yeah.
that.
Yeah. So young, ano talaga no? Kasi 'di ba pag boy, usually yung young, yung left. Oo. So pag strong
Mm-hmm.
right, women are right, women are always right now, girl. Sige,
Women.
try. Hanapin niyo lahat ng mga pregnant na ano, kailangan magpa-pasta. Okay. Floating pulse. How do you describe a floating pulse? So paulit na naman tayo, no? Floating pulse. Di ba there
This
are,
is felt as it, yeah. Yes, doc.
yeah, sure, continue po.
This is felt easily with light pressure, superficial like a piece of wood floating on the water.
Okay. Yes. Wood floating on water. Yeah. What is the indication of floating pulse? Ibig sabihin, what does it mean?
It's an exterior pattern. There's invasion of external wind and yin deficiency.
What else? Yeah, deficiency syndrome. So exterior syndrome, ibig sabihin from outside, no? Exter external wind invasion, external cold. Yeah. Cold wind, cold wind, no, wind cold, wind,
Mm-hmm.
ganon, no? And also deficiency syndrome, floating talaga sila. Okay? Lacking vitality, chi collapse. Diba? Pag, especially pag yin deficiency with empty heat. Now, sinking pulse.
This is only felt with deep pressure on
There we
deep
go.
level.
So, what is the indication of the sinking pulse?
Uh, this has to do with yin organ issues,
Okay.
internal disorder, and yang
Yeah, interior
deficiency.
syndrome. Okay. If it is sinking and forceful, it is interior excess. If it is sinking and weak, it is interior deficiency. Easy na, doktora? So sinking pulse, you can only
Ooh,
feel this at deeper pressure. Diba? So again, you need to
okay po.
qualify. Is it forceful? So if it's forceful, interior excess. If it's weak, interior deficient. Now let's go to slow pulse. What is our criterion? How many beats per
This
minute?
is 40 to 60 beats per minute, slower than 3 times per breath.
Okay, or less than 60. Basta slow. Okay. What is the
Uh,
indication of slow pulse?
this is Qi or Yang deficiency or cold.
Cold syndrome. Yes. So if it is slow and forceful, excess cold. If it is slow and weak, deficiency cold or yang deficiency, di ba? Remember?
Yang
Deficiency
deficiency,
or
yes po.
empty cold or yang deficiency.
Empty cold.
Yes. Rapid pulse description.
This is about 90 to 140 beats per minute, fast moving over 5 beats per respiration.
Okay. Rapid pulse indication.
It's a heat pattern,
Okay, so if
full
it
of full or empty heat.
yes, how do you
Yeah.
differentiate full from empty heat, excess heat from deficiency?
Uh, yeah, yes.
Forceful,
Exactly.
forceful and rapid, it's excess heat, right? Weak and rapid,
Yes po.
that's deficiency heat.
Deficiency heat.
So I think it's getting clearer now, no? Feel the basics muna tayo. Swift pulse. So swift pulse is faster than rapid pulse. Swift.
Mm-hmm.
So
So
what?
this is about 140 to 180 beats per minute, rapid,
So more
7
than
or more
140.
beats per breath.
Indication of swift pulse.
This indicates yin exhaustion or zeng qi collapse.
So approaching chi collapse. It's just like a candle about to, di ba? About to go off, no? Di ba? Yung gano'n.
Extreme heat.
Palakas muna bago ano. So,
Mm-hmm.
especially if you have a patient who's about to go, so they may feel,
Mm,
yes. Initially, you would think, oh, the patient now feels better, but it's actually telling us that the time is near. Okay.
okay.
I'm sure naman you've experienced some patients, di ba? Yung they were sick for quite a while, and then im- and then they start feeling better. After 2, 3 weeks,
Yes, doc.
they die. Okay?
Yeah, it happened to my father.
Yes, and also to my mom. They thought, oh,
Mm-hmm.
she's okay na. Lakas na kumain, rosy cheeks. Ay, nako. Okay, anyway.
Yeah.
So that's something that we should all remember. Okay? Kaya dapat, okay pa, we would already do something about our health, no? Mm. So I'm very
Yes,
excited,
exactly.
Doctora. Your plans are Herculean, are very parang gigantic. Alam ko na yung nasa utak mo.
Nakuha
Sakit.
mo talaga, Doc. Yes.
Oh yes, I know. And congratulations in advance. Empty pulse
You need
description.
to learn pa.
Siyempre, paulit-ulit lang to eh.
Shit is
No?
but without sense of emptiness, forceless at all three depths.
Okay, at all three levels. All three levels, empty pulse, that's weak. Okay, indication of empty pulse. Okay, deficiency syndrome. Okay, you know the big
I
five,
agree.
fast, yung, okay, research na lang, chi deficiency. Plus 5 pales, 1 yellow, that's blood deficiency. Plus slow, big 5 and cold, yang deficiency. Plus rapid and deficiency, heat yin deficiency. If you want, you can all watch the videos on pulse diagnosis given to
Acupuncture.
us by sa Acupuncture Matters. I tell you, ang dami,
Okay.
no? I'm planning to have another a simpler version. Yung mas ano, but it will take time siguro. Okay, let's go to excess or strong pulse description.
This is long, large, strong, and slightly wiry in all three positions and all three levels.
Strong and forceful at all three levels, no? Indication of excess pulse.
Full and or excess pattern.
Okay, excess syndrome. Okay, what is a slippery or rolling pulse? Oh my. Okay, rolling is
This
another.
are
Yes.
rolling.
Yeah, smooth and flowing.
Uh, yeah, smooth and flowing pearls, like
Burst
pearls rolling
rolling.
around in a ball.
Indication. This one you have to remember.
This is often due to phlegm or damp accumulation, food retention.
Also pregnancy and excess heat. You can have slippery pulse in excess heat. Excited na kayo
Uh-huh.
tumingin ng pulse ng mga buntis?
I want to check.
That way you can tell. No? Stronger yung pulse sa left, it must be a boy. Stronger yung pulse sa right, must be a.
Okay.
Okay, choppy
Yes.
or hesitant pulse. Description. Parang signal ng ano minsan.
Uh, Unsmooth pulse, slightly slow or sluggish, scraping bamboo with a knife, a river filled with rocks and sticks under the fingers.
Okay. So it is like bamboo, no? Rough, uneven, not smooth.
Smooth.
Indication of choppy pulse. Madami.
Excess or deficiency depending on force, stagnation, anything that affects the flow of blood.
Okay. If it is choppy and forceful, it is chi or blood stagnation. If it is choppy, yeah, if it is
And
food stagnation, it is also forceful. Phlegm retention. Di ba kasi excess yan eh. Essence impairment, weak. Blood deficiency, weak. Weak and choppy.
mhm.
Flooding or tidal pulse. Description.
Is wide and
Ganito yan,
forceful, but
doktora.
moves
So,
gently.
if the patient initially has flooding or tidal pulse, make sure that you know how to change the rhythm through your treatment.
Mhm.
If the patient went home and then it's still the flooding or tidal pulse, it's a waste of time, waste of money, di ba? Okay. So flooding or tidal
Mhm.
pulse, Hong Mai description. How do you define it po? Hello, Sir Alex.
It's float.
Flooding?
Yeah, it's floating, large,
Yes.
comes on exuberant, departs debilitated, forceful, and slippery.
Okay. Broad, large, and forceful. Yes. Forceful waves that fade away. Imagine the tidal wave, tidal pulse, no? Indication of flooding pulse.
Extreme heat
Yes.
in, yeah.
And also critical condition in prolonged illness. No? Um,
Mhm.
if you've been treating the patient and the pulse is still flooding, then there is a problem. Very big problem. Big or large
Mhm.
pulse description.
Pulse pauses at regular intervals after the pause. The pulse resumes.
Okay. These are broad and large with no forceful waves. Malaki lang siya. Indication ng
Mhm.
big pulse.
Uh, Qi blood Zhang deficiency.
Okay. If it is big and forceful, excess. Big and weak, deficiency. Makes sense?
Deficiency.
Mhm. So the
Yes
strength
po.
will tell us if excess or deficient. Now this one, thin or thready pulse, like a thread, like a fine thread. Diba? Nandiyan na oh.
It's yes.
So what is the indication of a thin pulse?
Blood deficiency,
Yes.
dampness with severe Qi deficiency.
Okay, it's not only blood deficiency, also yin deficiency and qi deficiency sometimes. Tight or tense pulse. Description. How do you describe a tight or tense pulse?
Vibrates left to right, like feeling a tightly twisted and snapping back and forth under the fingers.
It's like a stretched rope, tight and
Twisted.
forceful. So what is the indication of tight pulse?
Um, Interior excess or deficiency, cold invasion and pain.
Yeah. Actually, the most painful, um, the worst is pain due to cold. So in the future, we will talk
Mhm.
about the types of pain, no? So cold syndrome, pain, and food stagnation, the tight pulse yan. What about moderate pulse?
It's 4 beats per breath, about 60 beats per minute, comes and goes leisurely, slightly faster than slow pulse, on verge of being slow.
Okay. Normal rate, 4 beats per breath or 60.
Beats per minute.
Sandali lang may nagpapaano ng ano yung paisley. Pwede ba daw bukas kasi Sunday brownout? Sabi ko may generator naman. Okay, okay. Cool. So yun. Excited ako for you, Doktora. So I hope we can visit your place, your complex someday.
Someday po. Hopefully soon.
Okay, what is the indication? Uh, wait lang. Mas okay po tomorrow. Moderate pulse indication.
It's spleen and stomach deficiency, often dampness, moderate and weak.
Yeah. Normal pulse ito. Kasi moderate. Down syndrome, spleen and stomach deficiency, chi or blood deficiency. Long pulse. How do you describe a long pulse?
Smooth, straight, it extends behind the usual three positions, proximally or distally.
Okay.
Yan ang spirit.
I'm excited with this patient kasi I saw her last week. She was 53 and we tried to fix her lines and she was so surprised umakyat yung mukha. She's so
Oh,
happy.
really?
Yeah, so it's kaya I feel good. And then yung kasama niya
Excited din, Doc.
yeah, kasama niya nagpaano na rin. So I have
Ganun.
learned how to there was a time I had four because they all came from Ipil. Yeah, not Ipil, Dipolog pala. Dipolog. And I had to do
Pampanga
it
del
in
Norte po.
yeah, can you imagine four of them? Oh my God. Pagkatapos sumakit
Wow.
yung likod ko, buti na lang we had beds, no? So we had only two beds at the facial and five beds sa massage. So I had to use three beds of the massage room. Can you imagine me, you know, going from one bed to another? Sabi ko, ano ba to? Baka hindi yata ako tatagal. Okay. Four pala sila, not five. The wife, the husband, the brother-in-law, and the kasama. Oh yeah, four.
Sila lahat, Doc, nagpa-facial,
Yes.
facial
And they,
acu.
and they have to yes, acu. So hindi ko inano yung sa ear kasi ang hirap ng sa ear. My God. Sasakit yung mata mo sa ear. I did the
Mm.
conventional one. Um, it's so good. Ang dali
Intradermal.
actually maganda nga maganda nga dalawa or tatlo because like if you start with the no, pag first patients kasi I usually start at the back, no? You detox it. So the back shoe.
Mm.
Oo. So ngayon medyo in-incorporate ko na para mas mabilis na. You can already treat the back by using the ear. And what is amazing is na-address may iba nilang concerns. Yeah.
Mm-mm. Parang all in one na.
Yes. Oh, which is really exciting. And you have to make sure because they take pictures, so there should be a difference. So like last time, I don't usually see patients on a Sunday, pero ewan ko lang kasi ang bait-bait naman. So sige. So pinagbigyan ko. Buti na lang, bukas it will be a Saturday. So she was so excited.
Mhm.
Rosy cheeks na yung mukha niya. Then the lines were shallower. But we're not allowed to
Mhm.
send pictures. Okay, long and
Yeah.
long pulse indication. But I have pictures in my in my files.
Mm.
Sige, long pulse indication.
It's an excess interior heat or liver yang rising.
Okay. Pwede din siyang normal no? Kasi there are people talaga
Ano po?
all tatlong areas, no? It could be liver yang hyperactive, excess heat syndrome, morbid lung. Okay, short pulse description.
Pulse cannot be felt in all three positions, absent in the most proximal and distal ends.
So it is only felt at the guan position. Guan
Okay.
position. Now, what is the indication of a short pulse?
Chi stagnation or chi deficiency.
What's the difference? Short pulse, so if it's
Um,
chi stagnation is excess, di ba? So aside from the short pulse, what will be the strength of the pulse?
weak.
No, forceful. Excess ang chi
Ay, forceful.
stagnation, di ba?
Excess. Sorry. It's excess.
Chi deficiency, the pulse is weak. Okay? So,
Yes, doc. Sorry.
wiry pulse. Wiry.
Long, straight, and stiff.
Yeah, and long. Just like the violin string or the lute string. indication of,
Mhm.
ay, ang daming ganito, promise. Especially if the patient is in pain. And you will be surprised pag nawala na yung pain. Hindi na siya wiring. Hindi na siya wiring.
Mm.
Yeah. Okay.
Mm-mm.
And,
Indication.
okay, indication of the wiry pulse.
It's liver and gallbladder disorders, phlegm, rheum, fluids, cayenne, and pain, and malarial
Malaria.
disorder.
Okay. Liver, gallbladder disease, phlegm and dump retention, pain, malaria. Hollow pulse. Do you know the reason
Um,
why why phlegm and dump retention is wiry pulse? It all starts with a very strong liver, very stagnated liver, no? So, pag masyadong malakas yung liver, it weakens the spleen, so there will be phlegm and dampness. Okay? Kaya,
mhm.
liver pa rin. No? Hollow pulse, description.
It is floating stuff large body but empty in the center. Force
Sige
down
lang,
and
kaya mo
rapid
yan.
fluid.
Malapit na tayo matapos. Yeah, it is felt at the superficial and deep levels. So remember yung scallion stalk or onion stalk? Remember? Hollow siya sa gitna. Okay? That's hollow pulse. You can't feel the superficial and deep.
Superficial.
You can only feel it at the superficial and deep. Wala siya sa middle. Okay? So indication of hollow
Mhm.
pulse. Hollow, walang laman. What do you think is the problem here?
It's a serious blood deficiency, hemorrhage, or essence is lost.
Yeah, loss of blood, yin impairment. Leather or tympanic pulse description.
Pulse feels hard, tight, and stretched like a drum, completely empty at the deep level.
Okay.
Large pulse.
Yes. So only felt at the superficial level. Okay, leather. As I mentioned, as mentioned earlier, it's very common sa mga ano, medyo may edad na. So what's the indication of a leather pulse, Doctora?
It's a severe kidney yin or kidney essence deficiency.
Yes. Kaya nga may edad na, di ba? And also when you have loss of blood,
Yes.
confined or prison pulse. Grabe mga pangalan, no?
Hmm. This
Description.
is felt only, yeah, this is felt only at the deep level and is hard and wiry,
Okay.
as if wiry pulse at the deep level.
So is the indication of confined pulse.
This indicates blood stasis, interior cold, and pain.
Yes. Chi or blood stagnation, cold accumulation. As I mentioned earlier, um, if there is cold, there is pain. No? Hidden pulse, Fumai, description. Hidden,
Uh, Pulse is extremely deep and hard to find or feel.
of
It's
course.
beneath the bone.
Kaya nga hidden eh. Diba?
Hidden na.
Indication of hidden pulse.
It's an extreme young deficiency.
Okay. Pathogens in the interior, Chue syndrome, syncope, cold limbs, severe pain. Imagine na. If the, yeah, nawawala na yung ano niya. Moving or spinning bean pulse description.
This is a round shape like a bean. It is short and it falls under the finger. It has no definite shape, no head or tail, just like rising up, quivering and shaky and trembles.
Yeah. Indication of moving pulse or bean pulse.
Shock, anxiety, or extreme pain.
Yeah, pain or fright or shock. Soggy or soft pulse description.
This is floating, thin, soft, disappears when pressing deeply, like a saggy cotton ball floating on the
Yes,
surface water.
that's it. That's what I was looking for. Yung cotton, saggy cotton ball. Indication.
This is deficiency of stomach chi, yin, and blood,
And okay.
and dampness. Yeah.
What about minute pulse?
This is even thinner than a finer pulse and is extremely difficult to feel.
Okay. Indication. Obviously,
Severe chi and blood deficiency. Yeah.
deficiency syndrome. Ngayon nakikita nyo na, you're already getting what this is all about, no? This is simply diagnosing. What is important is you effect a change in the pulse. Frail or weak pulse, description.
Feel soft and can only felt at the deep level.
Yes. Indication,
Yang deficiency or blood deficiency.
yeah, Qi and blood deficiency. Qi or Yang deficiency. Parang pareho like, kasi Yang deficiency may cold na. Pero Qi deficiency pa rin yun. Scattered pulse, description.
Very small and relatively superficial. Also feels like the pulse has been broken. Small dots.
Okay, very good. Indication.
Severe blood and Qi deficiency, especially the kidney Qi.
Yeah, Qi exhaustion. Naubos na yung Qi. Hurried or abrupt pulse. Nagmamadali.
Pulse feels rapid, agitated, and urgent.
Yeah, it's rapid with irregular missed beats. Indications.
Excess of yang with fire, exhausting the yin. Excess heat.
Excess heat, Qi and blood stagnation, phlegm retention, food stagnation, prostration. Hurried pulse, precaution.
This can lead to blood clots in the heart. The condition also increase the risk of stroke, heart failure, and
Yeah,
other heart-related
so
complications.
it means you have to bring the patient to the hospital, no? It's an ER system. Bring the patient to the ER, call an ambulance. Knotted pulse.
Mm-mm. Pulse is slow and stops at irregular and short.
Great. Indication.
Cold with deficiency, heart yang debilitation of right chi.
Okay. Excess yin, Qi and blood stagnation, cold phlegm retention. Pabalik-balik lang, di ba? Precaution naman ng knotted pulse.
Heart disease.
Yes. And it is also an ER situation. Intermittent
Mhm.
pulse.
Pulse stops at regular intervals.
Indication.
Serious internal condition, likely a heart condition.
Heart Qi deficiency, wind syndrome, pain, fear, injury. Intermittent pulse, precautions.
Mm. Patient with this pulse have advanced heart disease according to what's this, and should be referred immediately to a Western doctor.
Great. In prolonged illness, weak condition with moderate pulse indicates naging
Key
moderate.
deficiency with other signs
Yeah, condition
like
is
fatigue. Getting better. It's
condition
getting
is
better.
getting better. In prolonged illness, weak condition with flooding pulse. Naging flooding yung pulse.
I don't have answer here though.
Critical condition.
Critical
critical.
condition.
Exterior syndrome, tapos moderate yung pulse. What does it mean? And you've been treating the patient for exterior wind cold, exterior wind heat. And then all of a sudden, after treatment, like maybe 2 sessions, the pulse is moderate. What does it mean? Is the condition getting worse or getting better?
Getting
Getting better. Exterior syndrome with rapid pulse indicates naging rapid na yung,
cold.
no, nag-interior na po siya. Pumasok.
May change to interior.
That's why these patients, they throw away their blanket kasi mainit na. Diba? Hindi na siya ano like, unlike in exterior syndrome, alternating chills and fever, ito, puro fever na lang. No? Rapid na yung pulse. So that means nag-change na to interior. That means if you caught the patient sa exterior, hindi effective, you didn't know what to do, pumasok na siya sa loob. Okay, the pulse does not match the condition. What does it mean?
Floating and rapid pulse.
The critical situation.
Critical
Floating and rapid
situation.
pulse indicates what?
Empty heat
Exterior heat
from
syndrome.
yin.
Floating and
Exterior
tight
heat.
pulse indicates
Wind cold. Exhaust pattern.
dito makakonect si si Doc Janine. Very bad internet. Buti na lang internet ko ngayon okay. Kagabi din, Diyos ko, ang hirap ng internet ko. Thready and rapid pulse. Thready,
Deficiency. Deficiency heat.
yeah, or empty heat. No? Now you know. Forceful and rapid.
Full heat.
Yes, or excess heat. Very good. We're almost done. Rapid, slippery, and wiry. Rapid.
Damp cold with stagnation.
No. Rapid yan, rapid.
Huh?
You cannot,
Rapid.
hindi siya cold dapat. Rapid siya eh. Yan
Oo.
palang heat na yan.
It's
Slippery, wiry, that's
just
phlegm. Phlegm heat or heat phlegm syndrome.
phlegm.
Pulses that indicate, the last one finally, what are the pulses that indicate deficiency syndrome? This is just a review.
Slow, rapid, wiry, floating without strength, closing, flooding, closing, soft, tingling, slow, chatty, tight,
Yeah.
deep, short, thin, minute.
Yeah, very good. Congratulations, Doctora. You were able to survive.
Naubos ko.
Oo, naubos mo
Asan na sila?
164 questions, 163, no? Congratulations, and we're looking forward to meeting you someday for the practicum. And based on your performance today, I can feel that you will become a very good clinician, no? So,
Hopefully,
maraming
Doc.
salamat po and congrats. Thank you, Doctora. I know you're exhausted.
Thanks po.
Ang dami pong patient today. And then, see you around.
Yes po, Doc. It's okay.
Thank you and congratulations. Perfect score.
Thank you po, Doc.
Grabe. I knew that you can do it, and thank God you came. You came. Maraming salamat. And have a great
Thanks, Doc.
weekend po. Thank you po. See you. Bye-bye. Thank you
Thanks,
everyone
Doc.
for joining.
Bye.